Welcome to Doctors at Work. My name's Matt Daniel, and this podcast is about doctors' careers. It's part of my mission to help doctors create successful and meaningful careers. Now, today's guest is Michael Akadiri, and he's a doctor and a comedian, and we have a discussion around making career decisions. He tells me how he made career decisions that pivoted from full-time surgery to what he does now, which is mostly comedy. We talk about the importance of uncertainty, and he tells me that that can be challenging, but it can be helped if you focus on what you can influence. And we talk about the importance of recognizing how a career fits into your overall life and the need to marry up your passion with a realistic career prospect in the future. Welcome, Michael. Tell me a little bit about yourself.
Yeah, hi. First of all, thank you, Matt, for having me on your platform. It's much appreciated. I would sort of describe myself a little bit like Clark Kent. So I have sort of two lives that I live. I have my daytime life, sort of the doctoring life, the medical life, and then at night I have my comedy life where I go tell jokes. And I've been living this secret life for many, many a year now. And now, probably in fairness, the comedy is probably more predominant in my life than the medicine. So I graduated from the University of Nottingham in 2016 and I did F1, F2. I took an F3 and F4, and then I undertook core surgical training down in London, CT1, CT2. And for the last couple of years, I've technically been on a sabbatical where I've been out of training.
Okay, and today's topic is portfolio career, and I'm very much
Yeah.
interested in how have you married up your comedy career with your clinical career? How do they fit? How do they fit together? And I wonder if I could maybe sort of start by asking I mean, how did you discover that comedy might be a career that you might have alongside medicine?
Yeah, it by total chance, by total accident, it was not planned at all. I During medical school, comedy wasn't even something that was in my brain. I knew myself that I enjoyed making people laugh. I guess if I was with a group of friends, and some were having a conversation, I knew I enjoyed adding a funny one-liner to the conversation to make people laugh. I knew that about myself, but I to contemplate a career, it wasn't even in my frontal cortex at all. So what happened was during my F1 year, I just sort of I was became a bit more curious about comedy, and I said, you know what? Let me see if there's anything in this. So I signed myself up for an open mic night in a house close to my parent in a comedy club close to my parents' house. And I don't know if you know about gong shows. I don't know if you've ever been to one, Matt.
Yeah.
But the concept of a but when I got there, they said, I thought it'd be an open mic night, but when I got there, they said it'll be a gong show. And a gong show is where the audience members have the power and the cards, and three audience members have cards, and you have to try to survive 5 minutes. But if they don't like what you're saying, all the cards go up.
Okay.
And that was my first foray into
Uh,
stand-up comedy in front of 300 people. So that was very nerve-wracking. And
yeah.
on my first ever performance, I was able to stay on stage for 3.5 minutes. So
Okay.
I thought that was pretty decent for a
Yeah.
first ever go, a
Yeah.
first ever swing at it. And I think there on that night, that fateful night in 2017, I caught the comedy bug,
Yeah.
and I've had it ever since.
Yeah, yeah. And I'm interested how you make career decision, because it sounds like
Yeah,
comedy was, oh, this sort of seems a bit interesting, and you gave it a go.
yeah.
And then you sort of thought, wow, fantastic. Is that also how you've made your clinical career decisions? Has that also been about, oh, this is fine, I'll go with it, or has it been sort of more rational, thought out about where the future might go?
Yeah, so during medical school, what I really wanted to do and what I was really interested in was sports medicine. So I'm a big sports fan, particularly football's my favorite sport. And I thought if there's a way I can marry a very personal interest with my occupation and sort of marry the two, that's the sort of the best of both worlds. So that was my logic. But when I look deeper into the specialty, it's arguably still a fledgling specialty, and obviously even more so about 10 years ago when I was at medical school. So I was wary of the job opportunities post training because there's a sports and medicine training program. You can become a registrar. There's three routes into it, whether through GP, ACCS route, or the core medical, or IMT as it's now called, route. and then you do sports and exercise medicine for 3 years, and then you become a consultant. But when I looked into it, I found that there wasn't many NHS jobs in it. And if there was some, of the few there were, only one or two were full-time posts. It was largely part-time work, and then you have to find maybe a sports team to work part-time with. I guess the luckiest people, if you want to call it luck, or the most fortuitous or fortunate people, would find a full-time post with a private sports team, i.e., they become the Arsenal team doctor, and then usually those sort of jobs you just stay in for 20 years because why would you leave? But I thought I can't make a career decision if I'm meant to be supporting a family, and you'll get to a point where you're a consultant, usually in your mid to late 30s. You don't work and study all that time to be in a position where your job security is not intact. So that's why I sort of pivoted slightly towards orthopedics, because it's a more well-defined specialty. There's NHS jobs all over the country. And what I'll be able to do, if still keep the sports interest, but just come at it from a surgical angle and look at treating sports injuries. There are some orthopedic consultants who now, because they're so well renowned in the sporting world, they only treat sporting injuries in the private world. So that's where I thought I could sort of go, and that seemed more of a sort of more well trodden path.
So I'm interested because I've heard you outline two quite different ways of making
Yeah,
career decisions. Yeah. So I heard you outline that, this is the end, this is where I want to be. So that there's lots of different things in medicine that you can enjoy. Yeah. Same as for me and for most of us, isn't it? There's
yeah,
so many bits of medicine and it's all interesting. But sort of I
yeah,
heard you say, okay, this is interesting. Number one, number two, where's my long-term career goal? What's my life going to be like in 10 years' time? And I'm wondering, in your comedy career, it was kind of, I'll do it, and yes, sort of this is fun. So how do you sort of square those two extremes of decision making, or do you, or it's sort of they just are? Yeah,
yeah. No, absolutely. Yeah, no, it's two. I think the comedy on one side, the medicine on the other side, they're two different parts of my brain. I think that's what it is. I
yeah,
think
yeah, yeah,
because medicine's very regimented. It's all pathways. It's all you do A, then you do B, then you
yeah,
do C.
yeah,
You follow when it comes to CPR, there's a very regimented
yeah, yeah,
procedure that you
yeah,
follow. Whereas comedy is the complete opposite.
yeah,
It's a blank canvas.
yeah,
You can be creative. You take it where you want to take it.
yeah,
You sort of throw stuff at the wall, you see what sticks.
yeah,
So I think comedy has allowed me to explore the creative side
yeah,
of myself that I probably wasn't exploring before.
yeah,
Like I would recreationally during medical school, I'll do sports, but I wouldn't really do anything creative of
yeah,
that sort of ilk. So when it comes to making decisions, I guess I try to be as regimented as possible with comedy, but the challenge is compared to medicine, there's no real defined
yeah,
career route
yeah, yeah,
in terms of there are things that people do, i.e., you start on the open mic circuit, and then you start building up your repertoire and your sort of act, your set, and then you start getting noticed, and you start going and start doing gigs on professional shows on the weekends where you may have a shorter slot where you're not really getting paid as much, and then you get to a point where you are doing paid work on a regular basis, and promoters start knowing you in your city, then up and down the country. But to really have a career in comedy, you have to have people that will be willing to pay to see you. And
yeah,
how do you get to a point where you have people that are willing to pay to see you? You just have to get yourself known. How do you get yourself known? Well, there's social media,
yeah,
put in
yeah,
making appearances on podcasts,
yeah,
i.e., this one. And if you're lucky enough, you sort of get picked up by the big wigs on TV and who put you in front of
yeah,
thousands or if not millions of people.
yeah.
So that's how you sort of you sort of make a career in comedy in terms of people knowing you, which is completely different in medicine. No one has to really know you. Your patients don't care how well you're known. They just want you just need to be competent enough to sort of treat them. So
Yeah,
that's where it's completely sort of different. So unfortunately, I can't use the same logic
yeah,
in both careers because
yeah.
they don't apply the same way.
Yeah, I think it is very relevant, I think, to the portfolio careers, yeah, because a portfolio career by definition is going to be very individual for different doctors. Yeah, the
Yeah,
people that have it, but everybody's portfolio career is different to somebody else's. So that creates quite a
absolutely.
lot of uncertainty, as in, as you said, who's my audience, who's going to pay me to do whatever I'm getting
Yeah.
paid to do in my portfolio career. How much am I going to work? What's my job security? And so a lot of that uncertainty arises in many portfolio careers. I mean, how do you handle that uncertainty? Because you could just have a really easy career where you just turned up, and there's always going to be a queue of
Yeah.
people waiting you, yeah, versus what you're
Yeah.
doing at home. And how do you handle that uncertainty?
It's a very important question. I don't know if I don't know if I handle it or maybe manage it's the right term because I can never eliminate it. I can never eliminate sort of uncertainty or what's going to happen because there's always fears and there's things you can control, there's things you sort of
Yeah,
can't control. So let's just take, for example, when applying for sort of core surgical training,
yeah,
they tell you what you can get points for. They give you a
yeah,
checklist. If
yeah,
if you've got a master's, you get points for this. If
yeah,
you've gone these courses, you get points for that. If you've done X amount of audits and closed loop audits, you get more points for this. So using the time I have before the application is due,
yeah,
I would be like, okay, realistically, I can do A, B, C.
yeah,
I can't do D, E, and F. So I should try not to worry about D, E, and F because that is beyond my control. I
yeah,
can't get a master's in 4 months. It's just not going to happen. It's
yeah,
beyond the scope. And that master's is only worth 2 points. So those 2 points I have to sort of forego.
yeah,
And it's more that sort of understanding that I can't get 100%
yeah,
and I have to be strategic in the points I'm going to try
yeah,
sort of to ascertain. So, and there will be someone who has a master's that I'm competing with for a job, and that's to their credit, that's there to their advantage, and I can't control that. And I think
yeah,
sometimes you have to understand that we've all got strengths and weaknesses,
yeah,
and you may not always have the time to address said weakness.
yeah,
So that's how I try to rationalize
yeah,
it by myself.
yeah,
And I also, as you go further along in your sort of medical career, it gets more competitive because there's less spaces, it contracts, and there's not space for everyone. And that's the sort of harsh sort of reality. And also what comes into that as well, particularly as we get to our later 20s and 30s, is that our desires change. So when you're just taking a typical medical student's journey, when you're early 20s and you're thinking what you want to do, you have a lot of energy, you have a lot of gusto, you have a lot of drive. That may not be the same 10 years later when you've got a young family and the attraction of doing 24 hours on calls may not be the same when you're 30s and you've got your family. So I think those things also come in to sort of play when you're making sort of career decisions as well.
And how have you made decisions about how much you do comedy versus how much you do clinical career? What kind of things do you think about? What goes into your mind when you're making those balancing decisions?
Yeah, so I would say I took a sabbatical where I've just taken I complete core surgical training, and then after that, my that same month my son was born.
Oh,
So
congratulations. Yeah.
oh, thank you so much. So naturally, I took the decision just to quit medicine and take a step out and go on a sabbatical, as you do,
Yeah.
when you have a child. So, but that was mainly driven by two things. One, my comedy career was sort of to take off, and I myself needed to know whether comedy is a career or it's a hobby.
Mhm.
Because it's going, well, I need to know whether is this something that I just do on the weekend here and
Yeah.
there, and it's a bit of
Yeah. Yeah.
fun and it's a bit of pocket money, or is it something where it's like, no, Michael, this is an actual career and you can really take it all the way.
Yeah.
So I just wanted to give myself some time just to really assess that, but I knew I couldn't make that decision whilst being full time in the NHS because something's got to give. I don't think, maybe you've spoken to people who've demonstrated otherwise. I don't think you could be a full time registrar in the NHS, whatever specialty you're doing, but also have a very busy life outside it. I think something's got to give, especially when you're a registrar. There's usually more some reading you've got to do, or there's some exams you've got to be preparing for. You can't have a full time schedule on calls and have a comedy career on the side. I don't think works
Yeah.
personally.
Yeah.
So, or you can do it. It's very difficult. So I wanted to just have a sole focus, give that sole focus a few years to sort of see. And also my family life came into it as well. So my wife, she's a doctor, she works in the NHS. And I guess typically, if you want to look at percentages, when there's a child involved, it's usually the mother that takes a step back and has her career hampered to sort of raise children.
Yeah.
And I thought, well, if I'm gonna make this decision and sort of take a sabbatical from medicine anyway to see how comedy is gonna go, well, I can stay home with the child, and you can continue your career as you would like.
Yeah.
So even though it hampers my medical career, I was gonna quote unquote do that in a way anyway. So it was a way of allowing my wife to continue with her sort of medical sort of pursuits, but also allows me to be at home with my son, but doesn't, and also allows me to pursue comedy in the evening. So that's the way we've sort of worked it out. And I guess it's a unique situation, but it's a situation that works for us.
I hope you're enjoying the show. Please click subscribe so you'll be notified when new episodes become available. This podcast is part of my mission to help doctors create successful and meaningful careers. You can be part of that mission too by forwarding this show to one person who you think might benefit from listening. Thank you. Now on with the show. That idea of is it a career or is it a hobby, that really resonates with me. And if I think for that in my own sort of multiple different things that I do, there's always kind of, am I doing this properly or am I just sort of, is it just a hobby? And there's also something about kind of commitment, and particularly financial commitment, because if you make a financial commitment to a career, then that career's got to pay. Yeah, if it's a hobby, then often there's a think, I don't feel like it, I won't do it. I'm a bit tired, I won't do it. Not today, I'll do it tomorrow. And then so it's a hobby you do, when you feel like it, sort of, or is it a career? Because if it's a career, then you have to show up exactly the same as for the clinical career. It doesn't matter whether you want to or not, or whether you're tired or not. You've got to show up for it, and you've got to make it happen. So I really like that idea of kind of, is it a hobby or is it a career? And I'm guessing that also that for you, it probably started as a hobby, but sort of then gradually it transitions into a career. So it's not necessarily that one day you wake up and you say, that's it, yesterday it was a hobby, today I'm a professional comedian. So it's not like that. It's kind of very much a gradual transition where you do less and less of one and more of the other. And obviously, in the center, I think there's always very scary because you've let go of the old stuff, but you've not yet, you're letting go of your kind of formal medical training, but you kind of, you're not the world's best paid comedian yet. And in the middle, whenever there's a career transition, there's often a rather scary area.
Oh, absolutely. Yeah, most definitely. And that's something I've always sort of told myself. I would never let this pursuit of mine derail my sort of family and my family's finances. I would never be a starving artist in terms of compromise my family because what I want to do. I couldn't allow that to happen.
Yeah.
So whilst if I was a single man with no sort of dependence, of course you don't mind taking the cheaper option, or whether that means sleeping on the couch if it so meant that. But I can't do that to my family. So I always know with the comedy, with what I'm pursuing, there needs to be an income associated with that. And if it's not looking realistic, that's when I have to just hold my hands up and say, okay, maybe this is just a hobby for the weekend. And I do my Monday to Friday, which is not really in the NHS, but I do my Monday to Friday as a doctor. And then I spend my small free time doing gigs as and when on a sort of ad hoc basis.
Yeah.
So unfortunately, we've not got there yet, but I'm always mindful of that because I couldn't look at myself in the mirror if I was to let that happen.
Yeah. And it sounds like you're very flexible also, and it also sounds like that it's not just about the career, whatever the career is. Yeah, it's not just about the career, but career is just one aspect of your life. So there are many aspects of your life, and career, whichever career it is, that's just one of the aspects. So the career's got to fit into the rest of your life. Yeah, and it sounds like that's important.
Yeah, most definitely. I think I wear a few hats, but I guess the most important hat, I would say, I'm a husband and I'm a father, and I need to make sure that my family are well looked after and they're sort of good. And however, of course, within the legal means. However, I sort of provide is however I sort of provide. And if that means that I need to do medical work, it's not a bad sort of position to be in to say you work as a doctor to provide for your family.
Yeah.
So if that's where my future is, then so be it. But if my future is sort of being a comedian and I can provide that way, then great.
Yeah.
But I'm not gonna. My main thing is I won't compromise my family, and whatever is the path of least resistance to provide for my family in the long term, that's what I would do.
I'm interested in how medicine and comedy interact, sort of in other words, how your medical training helps you or hinders you being a comedian, and how your comedy career helps you or hinders you being a doctor.
Yes. So they're not the natural sort of pairing. You probably don't see that pairing quite so often, but there's people such as like Adam Kay and Paul Sinner who before me are sort of doctor comedians, doctors. But in terms of being a comedian with a background as a doctor, I think it helps in terms of the uniqueness of the material I could talk about on stage. There's not many comedians who have a medical degree. So when you're on a lineup or you do a talk show like I'm doing, and I can talk about things from an NHS perspective from the inside, it's just a bit more unique and a bit more refreshing compared to the stuff that a patient can talk about, if that sort of makes sense. Because, just being quite typical, a lot of male comedians, when they get to their 40s, they talk about having a prostate exam. And they talk about it from the perspective of, oh my goodness, someone's going to stick a finger in my bottom, and they talk about the ants and their fears and the anxiety of having one, which is obviously understandable. If you've never had one before or it's rare for you, that's quite scary. But for us as doctors, we do that a bit more frequently. So it's not a unique thing for us, so to speak. Yeah. So I can take things in a medical way and just I can be a bit more, I can talk about topics people just don't know about or will overlook to talk about, and things of that sort of ilk. So just to give an example, let me think of one from my previous show that is not too harsh.
I was gonna ask you for some of your favorite jokes that have arisen from your medical thing. So
So there's I talk about in my last show I talk about Ash Cash, because that's just to give you an example. That's something that the general population, even as public, the general population may not know so much about. Yeah. So this concept that, and comedically you sort of play on it, but this concept that doctors are reimbursed when a patient has passed away, even though that's not directly what happens. Comedically, it sounds funny, because when I told my friends when I was on their phone, I was like, "Oh, yeah, I've got a check. Why have you got this check? Oh, I need to cash this check because I did a cremation form." And then they're like, "Oh, so someone died and you got paid?" And I'm like, "It's not as bad as you're making it sound, but in theory, yes."
Yes.
And comedically, you can play on that. So I talked about that in my sort of first show. I talk about the things you see. Like, for example, when I was on psychiatry and I was wanting to defend one of my patients, because you talk about, obviously, there's a taboo around mental health, isn't there? And I was talking about a patient with schizophrenia that I was getting on with, and we both shared a love for wrestling. And then he was a Randy Orton fan, and Randy Orton's wrestler, who has a theme song which says, "I hear voices in my head. They talk to me. They understand. They talk to me." And I was in the show, I talk about how the patient was listening to this. He was singing this, and one of the nurses thought he was having a moment. I was like, "No, he's not having a moment. He's just listening to Randy Orton." Yeah. And then there was a bit of confusion. I defended the patient, and then next thing you know, the patient tried to obviously physically remove his penis. So I was like, "Oh no, okay, he really was unwell. He wasn't just singing the song." So it's situations like that I can talk about on stage, where a non-medical comedian doesn't have access to those sort of jokes.
Yeah. Does medicine hinder you as a comedian at all, or is it just it provide you material?
No, it provides material, but also I think that because doctors are held to such high esteem in society, there's a level of almost professionalism that I feel, I don't know if the audience expects it, but I definitely feel it as a performer
Yeah,
that I need to sort of uphold the profession, so to speak. I need to make sure I behave in a manner that is of becoming of a doctor. Whilst I'm in that capacity as a comedian, not as a doctor, I
yeah,
still feel that if I've said I'm a doctor publicly, I need to sort of make sure I act
yeah,
accordingly.
yeah,
So
yeah,
that's the pressure I sort of feel. So whereas there's probably some topics or some things other comedians may be able to say,
yeah,
I sort of in my mind still feel that okay, I probably shouldn't broach that because
yeah.
of the profession I'm sort of quote unquote representing. So that's probably where the hindrance is where there's something that I found funny, but I can't really say that. So I feel a bit I feel I have to hold myself back a little. But that doesn't come up too much, but it's something I'm definitely conscious of.
What about your clinical career, Michael? How does comedy help you or hinder you when you work as a doctor?
Yeah, most definitely. So I think humor is fantastic at diffusing any sort of tension. So I still do a few A&E shifts, like 3 or 4 months, just to keep my hand in. And for example, if I call a patient and they've been sitting in minors for about 3 hours, so they're tired, they've been sitting on a metal chair for a long time. If I'm able to call them up and I just drop a little one-liner, and that puts them at ease and diffuses a bit of tension, I try to utilize my humor in sort of that way, mainly just to make a patient feel at ease and feel comfortable. That's probably the way it sort of comes because I understand patients don't come to the hospital to be entertained. They don't come to hear jokes. Even though laughter is the best medicine, there's a time and place for laughter. So I only sort of utilize it if I feel that there's a tension that can be sort of diffused, but I don't use it as my main form of treatment.
And how do your colleagues react when they hear that you've got this alternative life?
Yeah, usually they try to ask me to crack a joke there and then, and I always tell them there's a fee associated with that. So
Okay, yeah,
yeah, then nothing for free.
yeah, 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 yeah,
You got to come to the tour show for that. Trust me, my daddy.
yeah,
So I joints. I used to keep it a secret. I talked about the Clark Kent at the top. I didn't tell my colleagues initially. I didn't tell them for quite a few years, and then I told them, and then they were really sort of like supportive, and they wanted to come to the shows and I'm fortunate enough that quite a few colleagues do tend to come on down to some of my shows. So yeah, which is quite nice. Quite nice of them actually.
And mentally, how do you make the switch? Sort of, if I kind of think of that Clark Kent metaphor, the
Yeah.
clothes change and then a different identity emerges. How do you mentally switch between your two different identities?
Yes, most definitely. So I would say that when I leave work anyway, before I got into comedy, when I leave work, I try to leave work at work. So if I'm at the car park and I'm leaving, it is okay, that was that.
Yeah,
That was the day.
yeah,
This is now the evening. And I try not to think about things too much moving forward, just because I always find it a bad trait to take work home with you.
yeah,
It's easier said than done. It's very easy, especially if you've had a difficult day and stuff like that. But I try to just forget it as I leave. So I had that switch anyway. So it's definitely, but I'm able to now to turn on the comedy switch where I'm like, okay, I can be a bit more loose. I can be a bit more free. Not everything is regimented. It's sort of almost freeing because in medicine, I'm beholden by rules and principles and techniques to follow and flow charts to adhere to and BNFs to sort of subject myself to. Whereas in comedy world, it's a blank canvas. The only rule is make people laugh. That's
yeah,
it.
yeah.
How you do it is up to you, but you can do it however way you want. So it's almost just letting the shackles off, so to speak.
Yeah, yeah. That creativity that you talked about just now and also before, I think that strikes me as very important because there's lots of doctors that I talk to that maybe, once upon a time, sort of in their teens, would have been very creative and kind of full of really wide ideas. And then as all of us, as we go through school, and I know there's data out there, not just doctors, but everybody, as you go through
Yeah,
school, you gradually become less and less creative. That's what the education system does. As you progress through school, you
absolutely.
become less and less creative. And if I think, for me, the this kind of I've done ways of incorporating creativity into my clinical career, but for me that
Yeah,
might be that might be, obviously podcast aside, but it might be if I write
Yeah.
a guideline that sort of something is beautifully written or something is beautifully presented or something's beautifully drawn. And, for me, kind of that's where the creativity comes, or the clinic room is beautifully decorated, or, sort of I have stickers that I give to children,
Yeah.
so stuff that's out of the way. But I think a lot of the time, people as doctors, they do much of what we do is very rigid with really good reasons, yeah. But sort of if you are somebody who enjoys creativity, then it's kind of it's difficult to marry that up. So I'm wondering, from your travels in your clinical career, how have you seen doctors incorporate creativity into being doctors? If at all, maybe you haven't seen it, but if you can think of some examples, or what
Mm.
tips might you give to a practicing doctor who says creativity is really important. I'm not going to be a stand-up comedian, but how
Yeah,
can,
of
how can I
course.
how can I bring creativity into my clinical practice?
Yeah, I would say with that, in terms of sort of quality improvement projects, that's the place that initially when you ask that question, that's the top of my head. That's why I
Uh,
think, because obviously you look at, obviously with any audit or quality improvement project, you're looking at the current standards. Are we adhering to the standards? And you
yeah,
look at ways of moving closer to adhering to said standards. So when you're coming up with ways that your department or your ward or wherever the place is can adhere to the standards, there could be creative ways of doing that. Is it a case of moving from a paper system to an online system? Do you want to be involved in creating this online system or creating the online form that we sort of utilize? Is it a case of being involved in transitioning from old school bleep system to sort of message with a job system?
yeah,
Things of that sort of ilk. And the only challenge I would sort of say is in my clinical experience, it may be different for you or other people, is that sometimes trusts and hospitals can be resistant to change.
yeah,
That's the only sort of bugbear about one of my bugbears about the NHS. To get anything changed, you have to go through several sort of hoops. Even though it may be something that is beneficial, to really enact change, you have to get so many signatures.
yeah,
So that's the only hurdle
yeah.
a doctor who wants to initiate change may sort of find. But that's probably one way, and probably a beneficial way to clinical work and your work with your colleagues and your patients is if you're doing a quality improvement project, the changes you can act, they can be quite creative.
Yeah. And I think I'd say it depends on the stages that people are at, because I guess as a consultant, I probably maybe have more autonomy
Most
than
definitely.
although I definitely kind of share this idea that NHS is very hierarchical, and sort of, there's so many processes, so many boxes to tick, and that can make it tricky. And I'm sure the NHS doesn't want to be that way. I don't think NHS
Ah,
wants
absolutely.
to be and responsive to what the patients need. Yeah.
Yeah, because it's such a big organization, and sometimes, especially if you're a junior, obviously I know they're using the term residence now, especially if you're a resident, then the challenge is that you're only in post for a few months, maybe 4 months, maybe 6 months. So by the time you really get going with this quip and you really want to enact, especially if it's a quite bigger change, you may be on a different job, you may be in a different hospital, different site completely. So you don't get to always follow through. That's probably why it's beneficial if you're a registrar, but then if you're a registrar, you're trying to, from a surgical perspective, you're trying to get your logbook numbers up. So you may not be so focused on trying to improve the lay of the land, so to speak. So that's where the challenge is. The people need to have time and work time in place and time during their schedule to look at and enact said changes, which NHS is not always the best for time, but there we go.
And I'm thinking also headspace, because if I think for you as a comedian,
Yeah,
you're going to be developing materials, I'm guessing that you don't develop your routine, in 10 minutes during your lunch break. I'm guessing that sort of
absolutely.
in the right, not just physical time, but the kind of the headspace that's needed
Absolutely.
for that creativity to come out.
Absolutely, yeah. I unfortunately for me, most of my best jokes come to me in the morning.
Yeah,
So it just mornings just seems to be the time when my brain's just firing and there's sort of freedom. And when I was working, I'd always find it challenging because I'll get up and preparing, get doing my normal morning routine to get to work. And I don't have the time always to just sit and go on my phone and write. I'm on the way. So it'll be like if I'm on the tube, then luckily I can just spend some time. Okay, an hour ago I thought of this. I'll quickly write down what I remember and then I could develop it later on. But I'll be on my way to work, and I then have to switch on to medical world. So, but that's just me. Maybe some other people are creative during later in the day, but I always find my best creativity comes in the morning.
I guess the key thing is that whatever people need to know themselves and what works for them and what time.
Absolutely.
I wonder if I could bring us to a close, Michael. I'm interested in maybe if you
Yep.
could summarize what we talked about. What would be your top tips for doctors at work?
Yeah, top tips for doctors at work. I would say go look at what your passions are and what the job market looks for in the future. Those are the two things I'll sort of marry up.
Yeah.
You may not, especially if you're sort of younger or sort of early in your career, the
Yeah.
energy you have now may not be the energy you have in 10 or 15 years. Your priorities now may not be the same priorities if you've got a family that you're looking to sort of provide for. I would also say, in terms of creativity, as we've alluded to, look at ways when you're doing your quips and your audits to sort of explore the creative side to you. So those will be sort of my top tips. But most importantly, don't be afraid to go against the norm. If you believe in yourself and you believe in what you want to do, you can jump off the sort of medical training conveyor belt, take time and take stock. We're in a world where AI is important, but it's never going to replace doctors, I don't think, in any of our lifetimes. So don't feel ashamed or don't feel threatened if you need to come off the training conveyor belt and do something for yourself or explore another interest. That's
Well,
what I want.
thank you very much, Michael.
Thank you very much, Matt. Much appreciated.